Hello viewers, we have some very special guests at VNN Studios today. They have come from the Trillium Foundation, and as you know, Trillium Foundation is doing a great job in the community. So we are going to talk to our guests just to find out the objectives and how the organization is being run. So Kathleen and Dylan, thank you very much for talking to us today and being in our studio. I would like to ask you, Kathleen, what are the main objectives of the foundation and how many patients do you treat annually?
Absolutely. So thank you so much for having Dylan and I here today. For those of you who may not be familiar with Trillium Health Partners, we're a 3-site hospital based in Mississauga and West Toronto. Our organization is comprised of Mississauga Hospital, Credit Valley Hospital, and Queensway Health Centre. Our foundation exists as the charitable arm of the hospital, and we raise funds for equipment purchases throughout the year, any redevelopment plans that the hospital has. So for example, we just finished the completion of our Credit Valley expansion, and that was supported through the foundation and through funds raised from the community. And many people don't realize this, but last year alone we had over 1.7 million patients visit our hospital, and that number continues to grow each year.
Okay. Dylan, of course, an organization like this Trillium Foundation requires a lot of funds just to stay sustainable. So how do you go about it?
Well, we get a lot of support from the community. So in terms of community events, we have organizers reaching out to us, service clubs in the area. They'll reach out to us to host walkathons and donate in terms of those. And in terms of annual events, the hospital also hosts galas like golf tournaments and the Diwali Gala. So those are some of the events that happen annually, and it's essentially the community coming together to support the foundation.
Okay. Kathleen, being a South Asian, of course, this is just a natural question. What are the main diseases that you see are plaguing the South Asian community?
Absolutely. So interestingly, across our community, we have over 150 languages that are spoken, which means that we have many different patients from all walks of life and all different cultural backgrounds coming through the doors of our hospitals. But in the South Asian population in particular, we are seeing a predisposition towards cardiac and cancer. And what's interesting is that across our community, the number of people who are actually presenting to our hospital with a chronic disease is increasing year over year. So for those of you who may not be familiar with the term chronic disease, this ranges from cancer to cardiac to respiratory disease to diabetes. And these are all conditions which are presenting in patients, particularly within the South Asian population, and where we're now actually seeing over 60% of our community is presenting with at least one chronic illness, and now we're actually seeing patients who are presenting with multiple chronic illnesses. So this is something that the hospital community is acutely aware of and working hard to be able to cater treatment around that.
Okay. For the longest time, the foundation is also associated with Indo Canadian Golf Tournaments.
Absolutely.
So how has that helped the hospital replenish its funds over the years?
We have been so fortunate to have shared a partnership with the Indo Canadian Golf Association, and the partnership was really formed out of and inspired by the treatment that many of its members had received, whether it was themselves or their family members, within our cardiac program in particular. And Trillium Health Partners prides itself on having a cardiac regional center, which essentially means that anyone who is from the areas of Mississauga, West Toronto, South Oakville, Brampton, Georgetown, Milton, in the event of a major cardiac episode, they're actually bypassing their local hospital and they're taken directly to our Mississauga hospital site and treated in our cardiac program. And the Indo Canadian Golf Association has committed $250,000 to advancing our cardiac program. So as shared earlier, we really work with with our community and the foundation to be able to continue to purchase equipment that is needed within the teams and to redevelop space. So, for example, right now at our Mississauga Hospital site, we have our catheterization labs, and we will be redeveloping our 4th cath lab as a result of funding that's received from the community.
Dylan, I know you have worked for a very long time in the community, and you have been associated with the very objective kind of work that you have done. But coming now to the hospital, how do you find the work here, and what are your challenges as a new comer, and what achievements you have seen over the years that the foundation has achieved? So what are those?
Well, as a newcomer, I think just it's a lot of information learning about the hospital industry, the donors in the area, and how they want to support the community. And what I've enjoyed the most is actually talking to the donors and getting to know their personal connection with the hospital. It's always so special to hear about their personal story. That's what motivates me, and I think just in terms of, as you said, the biggest challenge would be learning all the information in the medical field. I'm not a doctor, so sometimes it's a little bit hard to get that information through, but yeah, it's exciting work.
Okay, thank you very much for talking to us, Caitlin and Dylan. We are so pleased you could come and share this information with us, and we'll keep talking to you. So all the best for your good work.
Thank you so much for having us.
And that's all from us today. We'll keep bringing such exciting stories to you in the days to come. Please stay connected with VNN Canada.